Hello, everyone. Let's start with a couple of questions. Who likes a big meal? Yeah. And who likes to smoke a nice cigar after this big meal? Yeah. Who likes to exercise? Not too many hands. I'm talking about behavior. And sometimes I think, well, I would like to change some of my behaviors. Not so many big meals, a little bit more exercise. That would be nice. So, as I said, I was talking about behavior. And since we're talking about behavior, recently we have been doing some experiments. You might recall seeing some notes here and there in the theater, right? Yeah, that's right, because you all were part of the experiments. Let me tell you what we did. You might remember these guys. That's my team, and they were in the building. And before anyone arrived this morning, they came in and they sneaked into the bathrooms. Yeah, and now people are saying, oh yeah, I saw something. They filled the dispensers with an equal amount of paper towels. And paper towels, that's something we all use. We use them to dry our hands, and often we use more paper towels than that we actually need. And that's a waste. It's a strain on the environment, and it has high costs. So that was the first experiment. Should we use more or less paper towels? And here you can see Lisanne filling the dispenser with an equal amount of paper towels. On some of the paper dispensers, we hang a note. And the note said, and I will translate it because it was in Dutch, in this theater, guests use only one paper towel to dry their hands. That's it. That's all what we did, nothing else. And although we had only 2.5 hours, we checked the results after lunch break. And what did we see? This was measured in the male's bathroom. In the dispensers that had a note, we found more paper towels, indicating that after reading the note, you used less paper towels. And we call that social herding. You take cues on what the right behavior is. You do that by observing. Very simple intervention, good impact on the behavior. And the same happened in the women's bathroom, maybe even more. That was not the only experiment. In the second experiment, the question was semi-skimmed or not. Maybe you will remember the note. And the desired behavior was use more skimmed, half-skimmed milk instead of the fatty whole alternative. And the only thing that we did was to place a note next to the glasses of milk that provided information about how long you have to exercise to burn off the calories. And again, we had only a short period of time. And luckily, people behind the bar were so helpful, and they counted the glasses. And here you see the results. You were motivated to drink more demi-skimmed milk instead of the fatty whole alternative. Again, very simple. And obviously, you don't care about the calories. You just care about the time you have to spend in the gym. And that's enough motivation for you to choose this skimmed milk. The experiments that we did are all based on the idea of nudging. In this picture, you see the mother elephant gently nudging her calf into the right direction. So nudging is based on indirect encouragement. It's never direct instruction or reinforcement. So to give you another example, adding a text to a donation box would count as a nudge, but forcing people to give to charity via taxes obviously is not a nudge. What do we see here? What is this? Come on, males in the room? Urinoirs. And what's the big problem with the urinoirs? Spillage, exactly. When men go to the bathroom and they see a urinoir, well, it's just a big problem. Massive cleaning costs. So how can we solve this problem? Exactly, people know. The simple edging of the housefly into the bowl gives men something to aim at. And when you give a man something to aim at, it will try to kill it. And that's exactly what happened. And there were amazing results. Spillage reduction by 80%. So the costs dropped. I think this is brilliant. It's brilliant because it's simple, and the intervention hardly costs anything, and the results are impressive. And some people get really creative. I think this one should be used in football stadiums. It's just great, you know? Let's go to the next level. I've been talking about behavior. I've been talking about changing behavior. And let's look at the relation between behavior and health. Is there a relation between behavior and health? I think so. Chronic diseases that are related to health behaviors like cardiovascular disease, diabetes, currently account for more than 60% of worldwide deaths. So policymakers and healthcare practitioners are keen on finding new methods to address these unhealthy behaviors. So about what type of behaviors am I talking? I'm talking about smoking, I'm talking about physical inactivity, I'm talking about eating too much, too unhealthy. And the question is, what can we do to help these people to change their behaviors in a way that it's easy, in a way that it's effective for everyone, and in a way that we can do it at a low cost? And here's my answer. We need innovation in health promotion. We need to find new strategies to design interventions that we can use in health promotion. And as we all know, cities like Rotterdam face many challenges. Health inequalities are one of these challenges. But luckily, in this city, we have this we can make it happen mentality. So my answer to how to help these people would be in taking initiative. One of these initiatives is the Rotterdam Center for Health Promotion. This is an initiative I'm very passionate about, because in this center we are using new methods and new initiatives to address unhealthy behaviors. It would be exciting to know whether the nudges would be applicable to the populations of cities, multicultural cities like Rotterdam. It would be nice and very important to know whether nudges are equally effective for people with a low education and people with a high education. And it would be fascinating to know whether nudges work across cultures. So imagine that we would be able to find nudges that we could use to address health inequalities. Wouldn't you want that? I would. Thank you.